The USF College of Nursing is working to get more nurses into the profession. As part of our special report on the nursing shortage happening across the country, I spoke with the dean of USF's College of Nursing about the shifting programs in the college and how this is going to get more health professionals into the pipeline. Dean Menon first told me about the programs they have now and how they're changing.
So we have multiple undergraduate pathways in the College of Nursing. They are called, typically they're pre-licensure programs. So these are students who are coming in here to be educated and then take the registered nurse licensing exam. But we have also for several years had something called the RN to Bsn Completion Program. And this is for nurses. These are registered nurses in the community who are working, who have an associate degree in nursing, and are now choosing to come back to turn that into a bachelor's degree of nursing. And it's an important role because it allows nurses to advance in their careers, go on to graduate education. But we also know there is evidence, and there's quite a bit of publication on looking at sort of the quality of care that is provided at the bedside, and patient outcomes are positively impacted by, bachelor's prepared nurses taking care of them. And so we've been very excited to have had this program. But the biggest challenge that we are facing in the nursing profession today is burnout and the moral injury that nurses have gone through because of this pandemic. And we are seeing unexpectedly large numbers of nurses leaving the profession. In the next year, by 2022, the estimate is that the US will need another 1.1 million nurses. And in Florida, the shortage is escalating, where estimates show by 2025, we are really going to be in very great trouble. And as one of the larger schools of nursing in the area, we did not want to get to 2025 and look back and say, I wish we'd done something about it. We wanted to be forward thinking. This is our profession, we love it, but we recognize what an important role we have to play in the healthcare industry. So we did some really hard thinking about where to allocate our resources. How can we put more nurses, into the pipeline, into the community, into the profession? And what we realized is that the RN to BSN program allows us to help nurses advance, but it doesn't help us put new nurses into the profession. So we are essentially sunsetting the RN to BS program so that we can take those resources and apply them towards our pre-licensure pathways. And we have two ways that nurses come into our pre-licensure program. They're called the upper division. So they come in, they're admitted to USF, and then they're coming through their 4-year degree. But we also have something called the accelerated second degree program. And that program specifically is for those who have a bachelor's degree in a different field and now want to become nurses. So they go through an accelerated program where they're really focusing not on their general education classes for the bachelor's, but just on their nursing courses. And they can go through in 5 or 6 semesters. It's a lockstep, very intense program. And we have been running that in Tampa, in Sarasota, Manatee, and St. Petersburg. So our plan is to increase the seats and the enrollment across all 3 campuses in the pre-licensure program and the accelerated program.
How many people will be allowed into the program that wouldn't have been if this other program was still in place?
So I could not give you the exact numbers because we're working through. So one of the things, Lauren, is that we have got to work with our clinical partners in the area because these students are going to need clinical placements. So we're working with each of the partners individually. All of the hospitals have been very receptive to what we're doing, but we're working with them individually to see what is the appropriate model to put into place, for the next 2 years. But our anticipation is that by the time we completely close out the RN to BS program, we would like to have increased what we're thinking of as turnout into the profession, new nurses, by about 24%.
Okay, so you're essentially taking away a program, but just adding to another one, not necessarily creating a new one.
Yes, adding to 4 pathways, actually, the upper division and then the 3 accelerated programs across Tampa, Sarasota, and St. Petersburg. And the number of seats that we increase across the campuses will differ because it will depend a little bit on capacity, but it will also depend on the clinical partners and how willing they are to open their doors and take more students in.
Right. Yeah, that completely makes sense. So how is this going to really specifically impact the Tampa Bay area?
Our hope is that, we will retain these nurses in the area. Our hope is that when they get to their senior semester, we are really looking at putting in some programs and sort of putting them into hospital systems where we hope they will stay and they will just, transition. So we're putting some programs into place, like with the preceptorship students, as we call them, and we're really looking at ways that we can transition them professionally from that student status, into the hospital. And if we can give them some consistency in their clinical rotations, we think this may help the hospitals with retention. The other thing that we're doing is really focusing on helping nurses with self-care. So we have a program right now called the Frontline Wellness, and I think you all have reported on it before. We've had over 700 nurses go through this. It is free. It's a webinar series. It's 4 webinars. It really talks about resilience and taking care of yourself and the tools you need when you go back, into this world that is completely out of control around you in some ways. We are taking that program and adapting it to work specifically with Sarasota Memorial Hospital as a pilot to see whether we can put senior students through that program. So when they transition in, they already have a support system in place. They have at least the grid, of that support system in place when they go in. So I think that's the other thing that we have not focused on as much before, because we've been focused on educating nurses. They pass the exam, we put them in the community, and then we're like, okay, great, we'll go back to bringing new nurses in. But I think we have to look at retention, and we have to work with our clinical partners in the area.
All right. Thank you so much for joining us today. I really appreciate your insight.
Thank you, Lauren.